President, the Society of Thoracic Surgeons USA, Dr. Lokesh Rao garu, Dr. Kunal Sarkar, Dr. Gopi Chand, Dr. Chandrasekhar Padmanabhan, executive members of the newly formed Society of Corona Surgeons, and other doctors who are all joining this virtual program today. Friends, I am really delighted to be part of this inaugural program of the Society of Corona Surgeons. I am given to understand that the vision of this society is fundamentally, as was explained just now, to relate the data and undertake original research in the field of cardiovascular diseases, particularly on coronary artery surgery. Promoting research in medical field is extremely crucial, and such initiatives, I am sure, will help in providing authentic data. That's why when the Gopi Chand told me about this, I have readily accepted, because we need to promote such initiatives. In the past few decades, we have made huge progress in the medical field, undoubtedly. Today, India has emerged as a world-class player in the delivery of heart care, with the second largest number of coronary artery bypass graft surgeries being done in this country. We feel proud of the same. Our capabilities in the healthcare are also clearly established during the recent pandemic. Number of casualties is much lower when compared to some of the advanced countries in the world. I commend the selfless and remarkable service being rendered by the medical, paramedical, and other healthcare personnel ever since the pandemic has broken out. Friends, I'm happy to note that we are on the verge of releasing our own indigenous COVID vaccine soon. As a matter of fact, India has emerged as a medical tourism destination in the recent years. In the past, patients from India used to go abroad for treatment. Whenever there is some VIP needs some heart care, people used to go to USA and other Western countries. But patients from different countries, including developed ones, are coming to India for affordable and quality health care. Also, Indian doctors are serving in other countries have earned high reputation for their skills and knowledge. It is said that 1 in every 4 top doctors in the USA is from India. Let me share my observation with all of you on this occasion today. According to the World Health Organization's non-communicable diseases, NCDs, encompass a vast group of illness such as cardiovascular, chronic respiratory diseases, cancer, and diabetes. NCDs contribute to around 41 million, that is 71% of all the deaths globally, and about 5.87 million, that is around 60% of all deaths in India. Or in other words, 1 in 4 Indians is at the risk of dying from an NCD. Almost 3/4 of the NCD deaths and 82% of the 16 million people who died prematurely or before reaching 70 years of age occur in low and middle income countries. The rise of NCDs is mainly due to lifestyle changes, such as sedentary jobs, improvement in socio-economic status, leading to unhealthy and irregular dietary habits, high stress, sometimes needless stress also, smoking, and tobacco chewing. Disease like hypertension and diabetes strongly contribute to NCDs, particularly cardiovascular diseases. Sadly, the epidemic of NCDs posing a devastating effect for individuals, families, and communities. With the majority of cardiovascular disease-related deaths occurring in the age group between 40 to 70, the socio-economic costs associated with NCDs make it imperative to prevent and control them. I'm told that India has one of the highest burden of CVDs in the world, and the annual number of deaths from CVDs in India is projected to rise to 4.77 million in 2020 from 2.26 million in 90s. This is really worrisome. Our country has more than 3 crore heart patients, and close to 2 lakh heart surgeries are being performed every year. With the rising incidence of cardiovascular diseases, it is good to know that a few heart surgeons have come together to form the Society of Coronary Surgeons with a mission to prevent CVDs and the immense loss caused by them in terms of affecting productive people. My dear sisters and brothers, I'm happy to know that our cardiac surgeons have understood the need to pool the data and do consistent research to check the rising incidence of cardiovascular diseases and improve the lives of patients suffering from CVDs. I hope that the society, in tune with its motto, would dwell deep into the research on CVDs and try to bring down the increasing number of cardiac patients by identifying the causes and providing the right diagnosis and quality treatment. Friends, it's a matter of concern that the spread of healthcare infrastructure is lopsided, with most of the rural areas lacking in modern and advanced facilities. This situation has to be rectified on a war footing. The private sector must join hands with the government in bringing the latest healthcare, diagnostic, and treatment facilities to the rural areas at affordable cost through public-private partnership. Because India, even now, is mostly rural. 60% of the people live in rural areas. So for them to travel to the town or city, it involves expenditure, huge. It is estimated that nearly 86% of all the medical visits in India are by people from rural areas. With the coming here, transportation, staying here, then costs, all these things are a big burden. With majority of the people meeting the medical costs through out-of-pocket expenses, there is a huge need to step up insurance coverage also. We need to create awareness about the need for insurance and coverage of insurance. Ayushman Bharat program started by our Honorable Prime Minister Sri Narendra Bhai Modi is truly praiseworthy. It's a good initiative and seeks to provide health cover of rupees 5 lakhs per family per year for secondary and tertiary care hospitalization to over 10.74 crore poor and vulnerable families. I'm told approximately it will be around 50 crore beneficiaries. That's from the bottom of 40% of the Indian population. I would also urge the members of the society to focus on disease burden in the rural areas. All of you are aware the rural people are equally exposed to the risk factors of cardiovascular diseases. It is also disheartening to know that in the aspect of doctor-patient ratio, India is not matching with the norm set by the World Health Organization. There is one doctor for every 1,445 Indians, as per the country's current population estimate of 135 crore, which is lower than the WHO's prescribed norm of one doctor for 1,000 people. We have to go a long way. The government of India, the state governments, they are doing their best, but this aspect needs to be addressed further. And the private sector must compliment the efforts of the government in providing affordable medical education. I'm happy that the Medical Council of India has relaxed the conditions for setting up new medical colleges. We should not compromise on the quality, but at the same time, we should really relax some of the conditions so that more and more colleges can be opened up. Finally, before concluding, I would urge everyone to regularly practice yoga and meditation and return to our traditional food habits to beat the stress caused by modern lifestyle and prevent cardiovascular diseases. The physical fitness is very much required. If you are physically fit, then you will be mentally alert also. For that, daily exercise, and secondly, good food habits, eating proteinous food, avoiding junk food is very much necessary. This is my advice to the people, particularly younger generation. The scientific community has concluded that inappropriate lifestyle is the major cause for the rise in the CVD incidence. Yoga and meditation are perfect tools to connect with one's inner self. Thanks to the efforts of our Prime Minister, the United Nations had declared June 21st as the International Day of Yoga to encourage people inculcate the habit of practicing it every day and enjoy its benefits. Yoga relieves one of stress and keep diseases at bay. Hence, yoga must become part of everyone's daily routine. I would urge upon the medical fraternity to see it reaches the rural people, the needy people, and also timely and affordable health care. That is very much important. Affordable. Because you know the costs are very high. There is even need to bring it down further. The medical profession, like political, the earlier days, of course, is a noble profession. The ethics and values systems should be followed by one and all, particularly people in the medical profession. Whatever required to be done has to be done. But whatever is not required should not be prescribed or should not be done at all. My dear friends, I would like to compliment Dr. Gopichand and Lokeshwar Rao and other friends who have taken this initiative. And also, I'm very happy to know that noted cardiovascular surgeons, including Dr. Srinath Reddy and all others are there. I'm not an expert on the subject, but I want this profession to grow. I want this profession to be made more people friendly and see to it that it becomes timely available and also affordable to all people. With these words, I hereby launch the Society of Coronary Surgeons and convey my best wishes to the Society of Coronary Surgeons. Thank you very much. Namaskar. Jai Hind.